So please allow me now to introduce to you all our first speaker, who is Ms. Kristen Hope, who is a research, advocacy, and participation advisor at Terre and the research coordinator of COVID-19. So the COVID-19 survey that Kristen led was participated in by 26,258 children aged 8 to 17 from 137 countries, the biggest global survey for children conducted during the pandemic. COVID-19 is a broad-based coalition of organizations, academics, and the UN, youth-led organizations, and children, of which CRC Asia is a part of. Kristen is committed to upholding children's rights and nurturing intergenerational partnerships. And Kristen Hope has worked in international child protection programming for over a decade, with a focus on participatory research and advocacy with children, families, and communities. Kristen has coordinated a number of global multi-agency initiatives, including the child participation component of the global study on children deprived of liberty and COVID-19. So please allow me now to have Kristen to share with you her research, which is, this is really a share of reflections. And she's going to present the results of this survey, the global survey, briefly, given the time limited. And she will be joined as well by Fariha, a 17-year-old from Pakistan. She is a student in her last year of A-levels and has been an active member of the Human Rights, Children and Youth Task Force, thereby advocating for child justice and protection. And also, she will be joined by Prathit, an 18-year-old and from India. He has been involved with COVID-19 and has been advocating for intergenerational partnership between children and adults and community awareness for rights of children. He's also a researcher, public policy enthusiast, and student of political science at University of Delhi. So the time is yours, Kristen.
Thank you, Dina. Thank you, everybody. It's such a pleasure to be here. I would like to ask Fariha and Prathit to join me, and I will give them also the floor for their opening comments and reflections as we start our presentation today. Thank you.
Hi, I'm Fariha, and I hope everyone here is well today. When I was initially getting into child rights activism and advocacy, I attended the first ever human rights conference in Pakistan. I was fully prepared and I was really excited to finally share my views and ideas. And it was the first time that I'd ever been given that kind of opportunity. But later, when it came time to draft the recommendation paper, they forgot to call me and other peers that I was with. And when I wanted to share my ideas, I was told that it had already been drafted. And I felt so excluded, and I felt like all my efforts had gone to waste because I genuinely believe that children have really meaningful things to say. And I didn't want any other child to feel the way that I did. So that's how I first got into child participation and advocacy. And I've been part of the Human Rights, Children and Youth Task Force, which mainly focuses on child justice and child participation. And then about a year ago, I was given the opportunity to work with COVID-19, and I helped design the COVID-19 survey as a part of the Child Advisory Group. And my work was now being recognized at an international level, which is something that had never happened before. And something that I feel it's really important to me is that my views, they were not only listened to, but they were considered as well.
Thank you, Fariha. Namaste to everyone. I'm Prathit from India, and I'd like to take a minute to reflect on what the pandemic has meant for me as a youth and as a child during the pandemic. My experience during the pandemic was, of course, a sort of mixed feeling that I encountered in terms of frustration, confusion, and not knowing what is going around me. And it was, of course, a time which mentally worked me up in terms of the education shifting online, and more so because I was in the middle of a very important examination during that time. But more so, I had a lot to observe in my own community and in my own country, when, of course, I saw the crisis that emerged out of the migration of daily wage workers who took on to streets to walk hundreds of miles with their families, some with their children, just to get a daily wage. And of course, I had the observation around me, the increasing rates of poverty, and in fact, the areas of where the countries around the world had progressed, including factors like child marriage, child trafficking, and others where substantial progress was achieved before the pandemic. All this went up during the pandemic. And it was really a drastic time for me as a young individual. But my mind also went around to children belonging to the marginalized communities. And I thought that when I with so much of resources with me, when I with having all the access around me could feel so frustrated, I could only think of what children from marginalized community, children from coming from different background would be feeling during this time. And another significant event that happened was that when I was taking the COVID-19 survey, I was faced with this very important question, which was, in fact, that how do you feel about your rights during the pandemic? It was remarkable because I realized that I had never been asked this question. And in fact, everyone had been, talking about what needs to be done during the pandemic and what decisions need to be taken during the pandemic. But no one actually talked about how I was feeling during the pandemic on the decisions taken on me. And so that was remarkable because I realized that children, according to the UN CRC, have a right to be heard. And that right to be heard was not exercised. And I could only think of what children from the marginalized communities have so much to say on this topic as I had. And children from different backgrounds had so much to communicate on this very thing, on their feelings during the pandemic. And that prompted me to join an initiative like COVID-19, which was so committed to recording experiences of children during the pandemic in form of data.
Thank you so much, Prathit, and thank you, Fariha. And again, thank you to CRC Asia for hosting us today and for giving us the opportunity to share the results of the COVID-19 initiative. I've been very privileged to work alongside Fariha, Prathit, and other child and youth advisors over the past year and a half. And this experience has really shown that children have demonstrated and continue to demonstrate their curiosity, their compassion, and their courage when facing adversity such as the pandemic. But more than anything, COVID-19 is a statement to insist that child participation is not a nice to have, but it is a fundamental requirement for duty bearers to fulfill children's human rights. So in that regard, I will highlight some of the main findings of the COVID-19 process and survey results. But due to time, obviously, I will not be able to go into detail. So really, it is just to give you a flavor of some of the things that have come out. And we will be sharing with you the links where you can access the full data set, which is in everyone-friendly format. But really today, what I wanted to speak about was really the scope of this initiative. What made it so powerful was, on one hand, the huge amount of partners that we were able to bring together. So as Terre, we coordinated this initiative with a range of national and international civil society organizations, academics, child and youth led organizations. We are particularly grateful to Child Rights Coalition Asia and many of the partners who are here on the call today for all of the work that they've put into really making this alive and ensuring that the survey was accessible to as many children as possible. And we are particularly grateful as well to Queen's University Belfast and our colleagues at the Centre for Children's Rights, who have been the academic lead for this and who have designed and analysed the survey with children according to their unique child rights-based methodology. And we were also very grateful to the Special Representative of the Secretary General on Violence Against Children for their input alongside all of the other partners. the testimony of this experience is that we're stronger together. So what did we do as COVID under 19? We as Fariha mentioned, we actually co-created the survey with children. So even in designing the survey, we consulted with 270 children from 28 countries, deciding what questions should be asked. What did children want to know about other children? Then the survey was translated into 28 languages, in addition to an easy read version for children with disabilities. And again, we cannot thank our partners enough for making sure this survey was translated into many languages of the Asian region, including Korean, including Thai, and many other languages. And many of you here may have also been involved in sharing the survey. We thank you immensely for affording that opportunity for children to participate. Then with the results, we involved children as co-researchers in analyzing the data, in interpreting it, in giving it meaning, because children are experts in their own experience as much as academics or child rights actors. And now we are in the process of using these data sets at global level and also at national level to inform child rights advocacy. So what did the data tell us? So here is a snapshot of the overall respondents to the survey. So as was said in the introduction, the survey was, to our knowledge, the largest global survey of children during COVID, using participatory rights-based methodology. Again, the methodology that was really led by Queen's University Belfast, which is about inquiring children's experiences of their rights using participatory methods. So through this process, 26,258 girls and boys from 137 countries shared their views. What's interesting is when we look at the age breakdown, is that many of them were, over half of them were under the age of between 8 and 13, which is quite unique also because often, child participatory research targets older children. When we look at the regional disaggregation of responses, we can see here on the right-hand side, we had almost 2/3 of respondents from the Latin American Caribbean region. So we had overwhelming responses from some Central American countries, but also significant and sizable samples from Western Europe and others group, Africa, Asia Pacific region, and Eastern Europe. Just to note, we're using the United Nations regional disaggregations here. So what does the data tell us? Again, I'm going to highlight some main findings across some main areas of children's rights. So first of all, we asked about the digital environment. Now, as many of you know, access to the internet is not in itself a right that's enshrined in the convention. However, it is seen as a gateway to other rights. This is reinforced by the new General Comment 25 of the Committee on the Rights of the Child, but it was also very clear during the pandemic. So when we look at the children's digital experiences, globally, we saw that 55% of children had access to the internet often or very often. But let's look at some of these regional disaggregations. I've highlighted here some of the data from the Asia Pacific group. We can see actually that that children in Asia, that 1 in 5 children across the Asia region who responded never had access to the internet when they needed it. And that is quite a significant finding. And again, it speaks to the ways in which different children in different regions, based on their background or where they're located, access their rights differently. There's a quote here from a child in Myanmar, also reminding us that it's essential to have free child-friendly version of children's information for entertainment and play, but also before that, the government should make sure that every child across the country has access to electricity. So the importance of the digital infrastructure, but also basic information communication infrastructure as well. So let's go as well deeper into some other rights. We asked about children's experiences of education. Again, overall in the global sample, 61% of children, so almost 2/3 of children said that education was better before the pandemic. And this was similar to the percentage in Asia, 2/3 of children saying that education was better before the pandemic, but also that children were expressing their frustrations that their views were not considered. For example, a boy from South Korea, 8 years old, said, "I would like to protest that a survey regarding school attendance on COVID-19 was conducted only to parents without asking for the opinions of children or adolescents. It is students who go to school, not parents." Another key finding was around access to health. Overall, in the global sample, 1 in 5 children, 20%, said that healthcare was better before the pandemic. Here, we can see the regional disaggregation. This was slightly higher for the Asia Pacific region, about just less than 30%. So 1 in 3 children saying that healthcare had gotten worse, essentially, since the pandemic. And it's really important for us to be mindful that it's not just physical health, but also mental health of children, as illustrated by this quote from a girl in India, who said, quote, "We are likely to experience worry, anxiety, and fear. This can include types of fear that are very similar to those experienced by adults, such as fear of dying, fear of relatives dying, or fear of what it means to receive medical treatment." Another right that we inquired about was also access to adequate standard of living. We saw overall that 40% of children worldwide felt that they had less money to meet their needs since the pandemic. And this was similar to the regional percentage across the Asia region. So 1 in 5 children saying, my math is not good. 2 in 5 children saying that they actually had less money now since the beginning of the pandemic. And this is really highlighted by this powerful quote by a girl from the Philippines, saying that a huge number of children are becoming more and more victims of intensive digital learning and sensitive digital learning and of poverty. And she is concerned that many children will be left behind. When we look at also protection, the right to protection globally, we found that 1 in 10 children, so 9% of children, felt less safe at home since the beginning of the pandemic. And what is very interesting when we look at the Asia region particularly is this was actually the Asia average was higher than the global average. So here we have 17% of children felt less safe at home. Here's a quote from a girl from Moldova saying, quote, "In cases of quarrels or violence in the family, I cannot ask for help because they cannot help me to go to another place. This is an issue. All the people are in quarantine. Many emergency phone numbers for certain issues are not working. You keep calling and nobody answers." So here we're also seeing some of these elements raised by Prathit in his introductory remarks around feelings of isolation and feelings of being suffocated as well in an environment at home. Another really important question that we asked was about the right to be heard. So we asked children, do you think your government is listening to children when it is making decisions about how to handle the coronavirus crisis? Overall, 38% of children felt that governments were not listening to them. That's the global, so overall, almost 40% of children across the globe felt that governments were not listening to them. And here's the regional disaggregation. And I just wanted to pause here. And I also want to invite Fariha and Prathit to provide their reflection. So just to help you read this graph, we have here in blue, the children who felt that their government was listening to them. And here in orange, the percentage who felt that their government was not listening, and in gray, those who were not sure. What is interesting when we look at this particularly is we see actually for the Asia region, there was the highest percentage of children, almost 40% of children saying that they felt their governments were listening to them compared to children in other geographical regions. So I'd just like to invite Fariha and Prathit to react to these findings. As children in the Asia region, when you look at this, what do you feel?
When I first saw this data, I was really surprised. And to be honest, in the beginning, I thought that I read it wrong or something. But then when I carefully thought about it and I considered it, I did realize that I did, in collaboration with the Ministry of Human Rights, select spaces for child courts. And I did speak alongside our Minister of Human Rights. And I did help edit radio messages that were used later on. So after thought and reflection, I have seen great efforts from the government of Pakistan to include children and help them share their views and thoughts. However, what I would like to say is that one thing that really speaks volumes here is the great amount of "I don't know" responses. Because these consistent "I don't know" responses means that they've never been asked those questions and they've never been given the opportunity to fully self-reflect. And I believe that it's time we start asking these questions because self-reflection is so important.
Thank you, Fariha. I think that I share the element of surprise that Fariha just talked about, that it's surprising that, the fact that, the data which we have before us, but at the same time, it is also a chance to reflect and observe some of the factors. For instance, the fact that, as we heard, that a meaningful partnership with children is yet lacking. And as we saw that, children have been expressing their frustration over, questions of their rights being asked to their parents, but not to them. And the fact that, governments around the world have not been able to meaningfully and, engage with children as equal partners is concerning, in fact. And a second observation that I draw, and I would like to extend on what Fariha said about the data on do not know option. A lot of children reflected on I don't know, and that is an important observation in itself, because it also reflects that the governments were not being able to communicate what the policies they had taken for children to children, which means that there was, of course, a lack of child-friendly information that went to children. And so imagine a world where children are not aware of the policies that are taken for them. And so this reflects how much there is a need for governments to come up with child-friendly information, child-friendly dissemination of policies that they take for the children. Because we need to remember the children are the right holders here. And we need to respect the right holders' position. The policies are modeled around them. And this is an observation that I draw. And perhaps what can be done is the fact that, as we have been doing in COVID-19, establishing intergenerational partnerships, connecting children who perhaps know about the policies and have thoughts about the policies with children who do not know about policies and do not have are not briefed about the policies. In this way, children who are able to know and gather information about the policies can empower children who do not know about the policies by giving them information, as we have been doing in COVID-19 currently, where we have peer mentors who are mentoring the new cohort on building capacities on data analysis. And so I feel that there is an imminent need for governments to develop child-friendly information and establish intergenerational partnerships.
Thank you, Prathit. Thank you, Fariha. And as you can see, children and young people are experts in analyzing data, and we welcome their views, and we also welcome more. So I'm going to wrap up now and pass the floor back to Fariha and Prathit to provide their concluding remarks. But I just wanted to end by saying, please join us. If you are interested, if you're working with children who are interested in international child rights advocacy, we have opportunities to join our international advisory group. The link is there. I'm hoping that someone will also pop it in the chat box. And thank you so much for our time today. I will pass to Fariha and Prathit. I think we only have 1 minute left for the conclusions, but over to you for your concluding remarks.
First of all, I would like to thank the entire COVID-19 team. It's been great working with them and being part of this great opportunity, and I look forward to continue working with them as a peer mentor. But I would also like to talk about how important and critical the implementation of the results of the survey are. I would like to give a short example of this. As evident from results of the survey, the pandemic has taken a great toll on the mental health of children, and many have said that they feel increasingly stressed during the pandemic. As a result of this, for example, GD Pakistan has been raising awareness on mental health on various platforms to ensure that a vast majority of people are reached and educated about the importance of mental health. This is so important because this survey helped us find out which areas to target and exactly what's lacking. And these results are communicated to people at a senior level to help shape the way policymakers can shape our futures. And lastly, I would like to say that the world is changing, and from COVID-19, it is evident that we don't know what the future holds. However, what we can do is keep everyone on the same page and make sure that everyone is working together. Children are our future, and we don't have one without them.
Thank you, Fariha. And I would like to extend gratitude, of course, to COVID-19, which has been such a platform to empower children's voices. And in fact, just as a concluding statement, I'd like to draw 3 conclusions, which I mainly draw from COVID-19 statements at the high-level political forum by the United Nations, which just happened recently, and also from our academic engagement in terms of intergenerationally engaging children and professionals in giving out academic articles, etc. So 3 interesting, concluding remarks that I would like to give is, firstly, how important is it at this time to involve children in terms of building policies, because we are preparing to build back better. And in this project of building back better, it is very important to record children's experiences and to disseminate the information and policies around children in a child-friendly way. And that is very important. And secondly, I'd like to talk how important is it to involve children in the process of data in itself, which is why we know all the relevant information today by children's involvement in data. And lastly, how important is it to meaningfully involve children as equal partners in the consultation, because we need to remember that this is not the last crisis before us. We have many crises to face, and at this time when we need peace and justice more than anything, I remember what Mahatma Gandhi said when he said that if we have to bring peace to the world, we must start with children. And at this time, peace, justice, and inclusion are the most important thing before us. Thank you so much.
All right, so that brings us into the end of this part. Thank you so much, Kristen, for sharing the highlights of the global survey and how child participation initiative was undertaken, and very important learning to us all working in the field. And of course, thank you so much, Fariha and Prathit, about your sharing as child advisors during this global survey. And it was indeed very important for us all to hear what you just said in your reflections. And what you experience really should be heard by everybody, especially the policymakers, that children should participate. They should be involved in meaningful way. So that's the end of this part. Let me share with you who will be the speaker for the next part. And we will have the sharing from Taiwan. And let me share with you who will be the speaker. That will be Professor Hong Chi-Chang, who is the Assistant Professor, Institute of Health Policy and Management, National Taiwan University. And she will be joined by Chi-Hung Hu, who is the Senior International Affairs Specialist on Child Welfare from Child Welfare League Foundation. And so they will share about the experience in child participation, child rights responsive emergency during the pandemic, and how the government actually brought in some initiatives. So for you, Professor Hong Chi-Chang, as well as Chi-Hung Wu, who is also our member of CRC Asia, the floor is yours.
Yeah, thank you, Diana. Okay. We will go back to the first slide. Yes, it's really my pleasure to participate in this meeting. And today I'm going to share the national response to the pandemic and children's participation. And next. So actually, because Taiwan Taiwan has have not many cases last year, and we have some cases at the beginning, but after that, we have a lot of control measures. So keep the country free from COVID-19 for over 250 days. And then in April this year, the pandemic really started in Taiwan. And next. So it's from May 19, we have a level 3 pandemic alert. And actually that is the policy that the government want to have everyone not really locked down, but try to work from home as much as possible. But children has been affected a lot because school was closed. Next. I want to talk about the measures that how to keep Taiwan free from COVID, because that is really related to the policy infrastructure. When many countries has been attacked by COVID-19 this last year, Taiwan was actually paid for a painful lesson in 2003 for the SARS. So at that time, many people died, including medical staffs. So the government learned from the painful lesson. So actually they revised the Communicable Disease Control Act. So in this pandemic, the government really can use the policy to create a safer environment and also collaborate with different sectors to help prevent the disease. So first of all is that we have the national measures, is that the government try to stop the virus out of the border, that we have from a very early stage, we have 14 days quarantine. And I think that is very important. Also, at the very beginning of the outbreak, and the government used the major face mask in public space and transportation. And also, like the government collaborate with the companies to increase the production line of face mask and alcohol production a lot. And also the government ration it, like for 10 face masks for 2 weeks for children. That is really calculated by how many days they need to go to school. And another thing is that the government set the price so that it's affordable for everyone to buy the face masks, but not just the rich people can get it. And also when we are shortage with the face mask, they don't allow anyone to, we need to buy from the government. Okay, to make sure everyone has it. And I think that is very important to keep the students going to the school safely. And so in addition to national measures, there's also school policies. So last year, the school didn't close, but the semester started 2 weeks later after the New Year's break. That is a very important period of time for the government to produce enough face masks, and also the schools can prepare for everything. Then so our children go back to school until this year in May. Okay, and every day in the school, there will be temperature checking. If there's a fever of the children, they will be sent back home, and children at school, then they need to wear face masks and promote hand wash. Another policy is that if there's one COVID case at school, then the classmates need to have 14 days quarantines at home. And if there are 2 cases at school, the school will close totally. But eventually, there are not many cases so the government try to minimize the impact to all students, but make it local. Yeah, and next. So those are very important. I think when children go to school, that is very important for them, not only for the education, but also for them to have healthy meal. And next one is I want to talk about one participation opportunity for children is that we start to implement the UNCRC quite late since the 2014. But last year, the government has basically daily press conference for adults, but last year there's one press conference for children. I think that is a good start. The government collaborates with the public TV with a youth program. So they select 11 students from different parts of Taiwan. So if they are based in Taipei, then they can join the conference. And if they also include some students from the north, south, and also offshore islands. So they asked the question about the pandemic, and the Minister of the Health and also the Minister of Education was there to answer their questions. So it's a very good opportunity. The children finally get to ask the key officials, and they get answers from the officials. Okay, next. And now I'm going to talk about a research conducted by the Children and Family Research Center based in my university. And this research is an ongoing research, and this is the preliminary data. And we select a city near Taipei, and before the end of July, there were 911 5th graders participate in this survey. They are 11 years old. So first of all is that we asked what's the equipment they use for learning from home. most of them, they use either laptop or computer, but we also see like almost half of them, they used mobile phone before. So it could be like the screen is really small and the children in Taiwan are very nearsighted. So we can imagine that can also affect their learning. Okay, next. And we also ask their anxiety level we use the STAI inventory. We ask them how they feel before and after learning from home. So we can see the anxiety level is slightly increased, but we also calculate how many percentage of their middle and high level anxiety. And we can see that after they learn from home, the percentage of feeling have middle or high level anxiety increased a lot. Next. Okay, and this is my last slide I want to share is that we also asked them that the things they worry about during the pandemic. So the first, the most common worry is that they worry that they might get a disease. And the second time is they worry that they use the screen for a very long time. It's actually the children, they express that they use like 9 to 12 hours the screen because of the online learning is very difficult for them. And the third one, worry is their relationship with their classmates, and also lacking privacy and family income are all their worries. So today I'm just share my result to here. And I also want to mention one thing is that I think it's really good to listen to COVID-19 research. And because of the political issue, Taiwanese children has been quite isolated or excluded. And I really hope there will be opportunity for Taiwanese children to participate in any international survey. And that's my presentation today. Thank you.
Thank you. Can I share our slides, please? All right, so I will be sharing my slide with you guys. Thank you, Dr. Zhang, for sharing your presentation with us. Here, my name is Zhi Hong. I'm from Child Welfare League Foundation from Taiwan, and I would like to share a little bit about our services after the school closed. So here's how we do child participation during the COVID-19 pandemic with the online format. So first, we focus on 3 directions. We focus on strengthening adult skills. We help them to better equip, help them to be more able to conduct child online activities. Then the second, we would like to change our child empowerment program into the online format. So we want a smooth transition for that. And thirdly, we're thinking because nowadays in Taiwan, more and more children are restricted from communication with their peers because of the COVID-19 restrictions. So we will try to encourage them to have their own voice heard online. So we create a child participation platform. And so first one, we will organize the online workshops for practitioners or teachers. We will teach them the techniques and different methods to create fun and engage on child online activities. We will also teach them how to use the softwares like Zoom, WebEx, Google Meet, and we teach them how to use Slido, Woodclap, and Jamboard, a variety of online engagement tools to help them to see their needs and design the best child online activities for their own lessons. And for the second one, here's the example for the training. So we have invited theater workers to share some dramatic elements and with the practitioners so that I can incorporate into their lesson plans. And the second one will be shifting our progress from face-to-face meetings to online. So we have 2 child empowerment programs. One is our CWF Child Empowerment Program. The other is the Child Delegate Empowerment Program. So for these 2 child empowerment programs, we change by first we will do the survey of the children's access to internet, and we give them support and assistance before we change the entire program children online. Then we will incorporate different fun and activities during the sessions. Then for the child delegate empowerment program, because for the purpose for this program is for the children to be able to enter the government to become the representative for children, and they will enter as the member of the child welfare and child rights committee members. So they will need to discuss various social issues. So we will change the discussion online. We will have a group discussion, we will have a panel discussion, and we will have we will invite some specialists to share their knowledge so that children can be better equipped when they try to write up the proposal, the policy proposal to the government. And thirdly, we will use the message app. Because we think that because they're not able to communicate with their peers face to face, so we have to use the format online. So we created a Line app. So in Taiwan, it's very popular for us to use Line. So in other countries, it may be a WhatsApp. But in Taiwan, we will create a group for these children so they can have the instant communication with their peers. They can share their ideas. They can collect the collective views together, and they can also even have a poll so that they can have instant communication even without seeing each other, even without being in the same room. And for the next one, so here are some examples. So here is the courses that we have prepared for the child delegates. And here's the group discussions that they have. They can separate into small groups, so they can bond together. They can have a better ways to work together to come up with the proposal that we would like to submit to the government. And here's some activities we will conduct before. Right after they join the program, so that we will ask them how they feel by using the body movement. So by using certain movement, we can see if he or she is excited, happy, or sad when they enter the program, so that we can better understand how we can move on from there. And here's the online engagement tool that we use. So for this one, we use Clap. So it is a anonymous kind of poll. So we ask the question to the children. So in this case, it will ask the children, what do you think adults view children? So the children can submit their answers. They can like the others' answers. They can vote for it. So the more votes, the bigger the font will be. So for this one, the answer that gets the most votes is that they think that adults think children understand nothing. They think children are immature. And for the next one, we asked another question to the children that, what do you think about children? How do you view yourself as a children? And the answer we received was that the most votes are, they think that we have our own ideas, we're passionate, we're daring to try, we have strong self-esteem. So you can see a big disparity between the two answers. And next one, we're moving on to our third direction. That's that because during pandemic, we have to think about doing the child participation online. So we created this platform called 1420 Hertz. That means that we give a safe environment for children to have their own voice heard by talking about various topics. We have a forum for children. They can just discuss everything they want. And we also have a section for them to write out official policy proposals. And we even have a contest for them. So here's what the page would look like. It is a very, we just launched this platform like last week, so it's very new for us as well. So there's one section that we have different themes for them. So they can talk about their education, their daily life, what they like, what they don't like. So everything is allowed as long as they're age from 14 to 20. And the second part is that they can write out an official policies proposal. If they submit the proposal to this platform, if they can receive 100 agreement from their peers by the end of this month, we will have the winner of this contest. Then we, Child Welfare League Foundation, because we're experiencing in the law amendment and enactment, so we will help these children to realize these policies. We will help them to advocate. We will help them to talk with the government. We will help them to submit this proposal to the government to actually make these policies come to life. And the fun part of this website is that it is actually really, it's like a game for children. So they can create their own characters. They can even buy jewels, they can even buy a unicorn, they can buy pets, they can have their own little planets, but they can also communicate with other children in the same time. So the children will find it a really safe and fun platform for them to engage in online discussion. So at the moment, we are still collecting more proposals and more people to join this platform, and we're really excited to see who will win this contest and what kind of policy that we will be helping to help them to realize in the future. So that's a short introduction for our services so far. Thank you.
Okay, thank you so much, Professor Hong Chi-Hung and Chi-Hung Wu. It's really good to know that children are involved by the government. The government listens to them. Also in your research in your university as well. And also to hear the initiatives to empower children to use online platforms to share their concerns, their ideas, to bring in solutions for issues they're facing, and also to be able to understand their feelings during this difficult time. So all this is really such, yeah, it's great learning for, to all of us. Okay, later on in the question and answer, we will also be joined by the head of researcher, Ms. Kahyu, that I will introduce later. But let me now introduce to you our next speaker in the next session, which is Ms. Marcela Dono from the Philippines, Manila, Philippines. And she is the Child Participation Working Group lead of the Civil Society Coalition on the Convention on the Rights of the Child. She's also a member of CRC Asia in the Philippines, and she's also a child protection specialist at Child Fund. And she will share the experience in child participation during the pandemic. Ms. Marcela Dono, the floor is yours.
Thank you so much, and thank you for that kind introduction. So may I request my PowerPoint, please? Yeah. Can we have it slideshow? Yeah. So we're happy. I'm very happy in behalf of the CRC coalition, or the Civil Society Coalition on the Convention on the Rights of the Child, to share with you the children's experience on child participation during the COVID context. Next slide, please. Yeah, first, let me introduce who we are. So the CRC Coalition is an alliance of 24 local and international child-focused organizations. You can see the logos, different logos beside, and we are working together to promote children's rights in the Philippines. We have been submitting periodic reports to the United Nations Committee on the Rights of the Child since 1994, and actively participated in other human rights reports, such as the Universal Periodic Review. We commit to lead civil society efforts towards strengthening government accountability for children's rights through a systematic monitoring of the implementation of the UNCRC. Next slide, please. So the coalition is a very strong four technical working groups. We have the systems, we have the capacity building, advocacy, communication, and of course, the child participation working group, who has a main role and responsibility in ensuring to work for the standards, minimum standards and principles of child participation that is being adhered to by the coalition and its member organization. And because of this, we receive a low rating from the UNICEF on the prevention of sexual exploitation and abuse. So with this, we also have a internal child participation toolkit that we follow, and because of this good rating that we have, we updated our toolkit. Next slide, please. Yeah. So looking for the situation of child participation in the Philippines, we have the youth councils, or we call it the Sangguniang Kabataan. It has a tremendous potential to develop the next generation of leaders, engage youth in the community, and teach them accountability, honesty, and creativity. However, their performance over the previous 10 years had been generally weak, as this is a politically created structure. Concerns about the ability of children, especially those belonging to minority and indigenous populations, to be heard within family, schools, institutions, the courts, and administrative bodies has been also limited. And further, the COVID-19 pandemic exacerbated the limited access of children's engagement in civic spaces, especially those with limited to no access to gadgets, internet infrastructure, and even economic and financial constraint. So most of them are, especially those who are vulnerable children, even during or prior to the COVID context or environment. Next slide, please. Yeah. So in our work, we put the child participation at the center of our work processes. And just to share with you some of the direct quotes that we hear from children on their participation. So their participation on the Local Council for the Protection of Children. So the LCPC is a mandated structure in the Philippines that allows participation or representation of children in the council. So they're saying, this is in Tagalog, but I can translate in English. So they say that pinapakinggan kami pero di na-implement ang mga suggestion namin. Hanggang doon lang. Meaning that yes, they're being consulted, but their views or their suggestion is not being considered. On the Youth Council or the Sangguniang Kabataan, they said that their target is not public service, but political aspiration. Hindi kami nilalapitan or kinukonsulta. The SK in my barangay is not functional. We think that they are not ready or capacitated. So as I mentioned, this Sangguniang Bayan is politically created. And yes, they said that they are not being consulted. On budgeting for child-focused program, they say that laws for children are not implemented due to lack of capacity and resources. They can't reach children from coastal areas due to transport costs. Hindi kami aware na may budget pala sa amin. So meaning the transparency of budget allocations in their communities are not being informed to them. Also, unlimited and unequal access to online platform. Yeah. So they said that sa online, hindi lahat nakaka-access. There are children in the mountains that has to walk up in the mountain just to access to signal or internet access. Yeah. One of our greatest contribution as a coalition is we have developed the child participation toolkit. That is as we mentioned, it is important to have guidelines. We need to have important protocols. It's not just bringing children to an event. So this toolkit defines the different protocols, preparations to be conducted, who will be engaged, how will they be engaged, how will they be protected before the event, during the event, and after the event. So this has been a very important document and guidelines and protocols in the coalition. Next slide, please. Thank you. So with that, right now there is a ongoing enhancement of the national guidebook on the Philippines on child participation. And because of our experience and available resources and toolkit that I mentioned, the coalition is a member of the technical working group, and we are supporting the commission, the consultant working on this enhanced guidebook, and supporting them in their different workshops and surveys, facilitating participation of children from among the members of our coalition. And also, we participate in the review, validation of the initial report, and this guidebook will soon be released and available for the general public. Next slide. Yeah, these are some examples of how the coalition has put the voices of children in different platforms. So one is we just launched our NGO alternative report with the hashtag Sulong Karapatan Pambata. So this was done online and has been participated by a lot of audiences from the government and the children themselves. And during that session, there's a parallel session of children where they also shared their part of the report. And then another one is we develop a quick guide for children to gain their power in time of pandemic and crisis, which has been a tool in conducting or coming up with the consultation on the situation of Filipino children during the COVID pandemic. This is in collaboration with the Council for the Welfare of Children and UNICEF, where the voices, opinions of children are clearly embedded. They provide their voices and opinions on how the survey will be conducted, the tools that will be conducted, the questionnaires, the initial reports has been validated by them. So this report is also available for sharing. So yeah, so it's very important to really bring the voices of children in any consultation. Now, as I mentioned, we are a member of 24 member organizations, and these are some examples that despite the COVID pandemic, it was not a barrier for our member organization to continue conduct awareness raising and capacity building with children. So these are some photos that you see from Child Hope, one of our member organization who continue to engage children. VIDES also, they continue to conduct children's activities, including Children's Month celebration, and Salangahi in terms of engaging children in activities for climate change, peer education on adolescent sexual reproductive health by KNH, one of our members, and of course Plan International, who is very active in engaging Filipino girls and young women in their program engagement. Next slides, please. Yeah, so this is more additional examples, particularly on advocacy. So we are, one of our member plan is very strong on advocacy in ending child marriage, also promoting safe spaces on online and offline, as we know, as mentioned by other speakers. The platform now is the online access, but we have to make them safe as they access to the internet. And of course, the right to play, even in time of COVID. And for Child Fund, we also engage young people to co-develop safety survey tools, and they lead on hosting virtual summit with their respective hashtags. So indeed, they really demonstrated their capacity to engage in different activities. And this is just another example of one of our partners. It's Salin Lahi. They're very strong on engaging children, even in their services, like they organize kitchen soups, and they distribute hygiene kits in times of COVID, and they conduct peer counseling. So that's one of our active member. It's Salin Lahi. Yeah. For Child Fund, we also they also use the radio program, live program broadcasting. It's very popular in our communities. Children are tapped, individual experts were tapped as a resource person, and this is being live in Facebook, so it can reach a lot of audiences, their peers, parents, and different stakeholders. And this is my second to the last slide. So also, we do not take the COVID as a barrier in training our children and youth in mental health and psychosocial, including psychological first aid. As mentioned also, this time is of COVID, there are different levels of coping mechanisms of children, including their peers, so they themselves reach their peers and conduct a psychological first aid. As we know, PFA, as long as they are trained, they can do it. So yeah, so my last slide is really a call and a message. We believe as the CRC coalition, as a strong coalition, we continue support creating safe and protected spaces for Filipino children and youth to have their voices heard and taken into account seriously by all. Yeah. So I hear. So anyway, by all duty bearers, it's our commitment to the convention, United Nations Convention on the Rights of the Child. So again, as child rights advocate and child participation advocate, let us not let the COVID-19 pandemic a barrier to listening to the views and opinions of children, but rather use it as an opportunity for children and opportunity for all of us as duty bearers. With that, I say thank you for listening, and I hope we were able to share with you how our coalition is trying to respond and cope with this pandemic situation and putting children yet still a priority. Thank you so much.
Thank you, Ms. Marcela Dano. Wow, there are so many initiatives in the coalition in the Philippines, and you have used a lot of children in the participating in various initiatives. So yeah, you have done NGO alternative reports using online method, a quick guide for children to gain their power in time of pandemic and other crises. Also advocacy in child marriage, also involving children there. Also asking children to voice out the right to play, as well as providing services in child empowerment, including providing counseling to children who need this service. And this is an important thing that you provide in the coalition, the psychological first aid from children to children. That's really a beautiful thing to do. all the wonderful work done in our region, Asia Pacific, in which children participation was encouraged and executed to ensure that their voices are heard and that the children's issues are well taken care of by the duty bearers and all parties related to child rights and child protection. Children suffer greatly during this pandemic COVID-19 in the scale that we never imagined before, either from domestic violence, lack of facilities for online learning, limited opportunities to optimally develop their cognitive, affective, and psychomotoric domains. The global research as presented by Kristen hope is important to look into. That will greatly help us to bring in prevention and measures of initiatives in dealing with the issues as identified in the findings. And the local initiatives as done in the Philippines as well as Taiwan are really great examples of how children were empowered to express their voices on what they are facing during this pandemic and their ideas on how to deal with them. Such children participation is the key to the success of any efforts targeted to children. And who would understand the most what children are facing? Really, it's and what they actually need during this tough time. Children's voices are so important to be heard. And therefore, thank you so much to Prathit and Fariha that we heard you today and that you have helped in the global research as well. So you have helped us in the work to protect children in the world. So I would like to end this by what Prathit was mentioning before, that it is important to involve children for policy making, and then that child-friendly materials should be disseminated, and that meaningful children's voices in decision making is important. So these three very important points were shared to end up our meeting today. And with that, I would like to pass on next to Amihan. Amihan, yes, now the floor is yours to close this,
Thank you,
meeting.
Dina. Yes, thank you, Dina. So I just want to say thank you to everyone who participated today. In behalf of the Board of Trustees of the CRC Asia and the CRC Asia Secretariat and our member organizations, we're really very happy to have you here, and we'd like to invite you to the next sessions. You can email us if you haven't received the links to the Zoom registration for the coming sessions. So we also would like you to please make sure that you send us your feedback so we can make this even better. And next week, we will be launching the general comment number 25. So again, thank you so much. Also want to say thank you to the ACWC, the ASEAN Secretariat, to Attorney Yasmin, former member of the UNCRC, and all the friends who were here, and all of our, member organizations and other organizations who have joined us. Please, thank you so much.